Droxia is a medication used to help people with sickle cell anemia by reducing the number of painful crises caused by the disease and decreasing the need for blood transfusions. It is also used to treat certain types of cancer, such as chronic myelogenous leukemia and squamous cell carcinomas. The daily dosage and optimal timing for taking Droxia will depend on the individual's condition and should be determined by a healthcare professional. When taking Droxia, it is important to follow the instructions provided by your doctor or pharmacist. Typically, it is taken once daily by mouth, with or without food. The dosage will be determined based on your weight, medical condition, lab results, and response to treatment. If your blood counts are too low, your treatment may be temporarily stopped. If you are using the capsules, swallow them whole and do not crush, chew, or open them. If you are using the tablets, swallow your dose with a glass of water. Only split a tablet if it has a score line and your doctor has instructed you to do so. If you have difficulty swallowing, you may dissolve the whole or split tablet in a small amount of water and swallow it right away. It is important to wash your hands before and after handling the medication or its container and wear disposable gloves. If powder from the tablet or capsule spills, it should be wiped up immediately with a wet paper towel and thrown away in a closed container. The spill area should be cleaned right away with soap and water, and care should be taken not to breathe the powder from the tablets/capsules. Women who are pregnant or may become pregnant should not handle this medication or breathe the dust from the tablets/capsules, as the drug can be absorbed through the skin and lungs. If your condition does not improve or gets worse, it is important to inform your doctor. Some common side effects of Droxia include nausea, vomiting, loss of appetite, mouth sores, diarrhea, or constipation. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. However, people prescribed with this medication may experience serious side effects. Your doctor has prescribed this drug because they believe the benefits outweigh the risks. Regular monitoring by your doctor can help reduce the risk of serious side effects. Contact your doctor immediately if you experience any serious side effects, such as skin problems, mental/mood changes, seizures, shortness of breath, yellowing of the eyes or skin, dark or bloody urine, or signs of kidney problems. Seek medical help right away if you have chest pain or notice symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not listed, it's best to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects. You may also report side effects to the FDA. In Canada, you can call your doctor for medical advice about side effects and report them to Health Canada. Droxia works by reducing the function of the bone marrow, which can result in a decrease in the number of blood cells, including red cells, white cells, and platelets. This may lead to anemia, a weakened ability to fight infections, and an increased risk of bruising and bleeding. If you experience symptoms such as persistent sore throat, cough, fever, chills, easy bruising, pale skin, or unusual tiredness, it's important to notify your doctor immediately. Additionally, hydroxyurea, the active ingredient in Droxia, has been associated with an increased risk of secondary cancers such as leukemia and skin cancer. To minimize this risk, it's important to protect your skin from the sun by avoiding prolonged exposure and using sunscreen and protective clothing when outdoors. Notify your doctor if you notice any symptoms of cancer, such as swollen glands, sudden weight loss, night sweats, or unusual skin growths or moles. When taking Droxia, it's important to follow your doctor's prescribed dosage and timing. This medication is typically taken once a day, and the dosage may vary depending on your specific condition. Be sure to take it at the same time each day for the best results and to minimize the risk of side effects. Before taking Droxia, it's important to talk to your doctor or pharmacist about any allergies you may have, as this medication may contain inactive ingredients that could cause allergic reactions or other problems. You should also discuss your medical history, especially if you have kidney disease, liver disease, blood/bone marrow disorders, HIV infection, high uric acid levels, or if you have had radiation treatment. Droxia can increase your risk of getting infections or make current infections worse, so it's important to avoid contact with anyone who has an infection that can easily spread, such as chickenpox, COVID-19, measles, or the flu. You should also talk to your doctor if you have been exposed to an infection. Before receiving any immunizations or vaccinations, make sure to inform your healthcare professional that you are using Droxia. It's also important to avoid contact with people who have recently received live vaccines, such as the flu vaccine inhaled through the nose. To lower the risk of getting cut, bruised, or injured, use caution with sharp objects like razors and nail cutters, and avoid activities like contact sports. If you are an older adult, you may be more sensitive to the side effects of this drug. It is currently unknown if this medication affects sperm, so if you plan to father a child, it's important to discuss the risks and benefits of using Droxia with your doctor. If you are pregnant or planning to become pregnant, it's essential to talk to your doctor, as Droxia may harm an unborn baby. Women using this medication should ask about reliable forms of birth control during treatment and for 6 months after the last dose, while men using this medication should ask about reliable forms of birth control during treatment and for 1 year after the last dose. Droxia also passes into breast milk and may have undesirable effects on a nursing infant, so it is not recommended to breastfeed while using this drug. It's important to consult your doctor before breastfeeding. When taking Droxia, it's important to be aware of potential drug interactions that could affect how it works or increase the risk of serious side effects. It's important to keep a list of all the medications and herbal products you are using and share it with your doctor and pharmacist. Do not make any changes to your medication without consulting your doctor. Droxia may interact with certain medications such as didanosine and stavudine. It's also important to note that this medication may interfere with certain lab tests, which could lead to false results. Make sure to inform all lab personnel and doctors that you are taking Droxia. As for the optimal timing and dosage, it's best to follow your doctor's instructions. They will determine the appropriate dosage and when is the best time to take this medication based on your individual needs. If someone has taken too much Droxia and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the US, you can reach your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include swelling or scaling of the hands and feet. Remember, it's always better to be safe and seek help if you are unsure. It's important not to share Droxia with others. Before starting this medication and while taking it, you will need to undergo lab and/or medical tests such as a complete blood count and kidney/liver function tests. Make sure to keep all medical and lab appointments. Your doctor may also recommend taking folic acid while on Droxia to reduce the risk of anemia. Be sure to ask your doctor for more details about this. If you happen to forget to take a dose of Droxia, just take it as soon as you remember. But if it's almost time for your next dose, then just skip the missed one and take your next dose at your regular scheduled time. It's important not to take a double dose to make up for the missed one. It's important to store Droxia at room temperature, away from light and moisture. Make sure to keep it in a safe place, away from children and pets. When it is expired or no longer needed, make sure to properly discard this product. You can consult your pharmacist or local waste disposal company for guidance on how to do so. And remember, do not flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.